So there's going to be lots of times for questions later. I will facilitate the questions just to make it a little bit easier for our speakers. So if you've got any questions, just pop them in the chat and I will ask them at the end. And we are going to send around the slides presented and the recording, hopefully tomorrow, if I can work out the technology, because it would be me doing it this week. I haven't got Alison working the magic in the background. Okay, so we've got about 14 people here. It's about 2 minutes past. So I am going to crack straight on with my slides, I think. So for those of you who don't know us, Cambridgeshire ACRE is a charity that's been working alongside rural communities across the county for over 100 years. At heart, our role is simple. We help rural communities help themselves and we stand alongside them when things feel complicated or stretched. A lot of what we do is about rural leadership. In practice, this means being a trusted partner. We bring people together, share good ideas between villages, help communities find funding, and make sure real voices are heard when decisions are being made. We aim to be the organisation that local groups can turn to when they have an idea or a challenge and want someone to help them work through it. We support community buildings like village halls and community centres, which are often the heart of rural life. We work with the volunteers who run them, helping with governance, funding and long-term sustainability so those spaces can continue to host everything from social groups to advice sessions. We also work on rural housing, helping communities understand their local housing need and, where appropriate, explore small-scale affordable homes for local people. It's about shaping development with communities, not doing things to them. Another key area is well-being and well-being and inclusion. Through our community hubs and village agents and our Macmillan project, we support people who might be isolated, digitally excluded, or struggling with the cost of living. It's practical, person-centred support that often stops small-scale issues becoming bigger crises. We're increasingly involved in the environment too, supporting communities with projects around water, flooding, biodiversity, and green spaces, helping rural areas become more resilient and climate aware. And we care about the rural economy. Thriving villages need jobs, skills, and sustainable local businesses. So we support communities to think about how they stay vibrant and viable in the long term. So really, we work at the point where people, place, and possibility meet. We're here to help rural communities stay strong, connected, and able to shape their own futures. So why do we run Staying Connected and why does it matter? Firstly, it's about expert insight. Rural communities often face complex issues and it's not always easy to know where to turn. These sessions share practical examples, research and real-life case studies so you can learn from what's already working elsewhere. Secondly, it's about practical guidance. We bring in specialists, sometimes from our own team and sometimes from partners, to give you useful, down-to-earth advice you can actually apply in your own community. It's also a space for discussion. We make time for you to share experiences, ask questions, and learn from each other. That peer support is often just as valuable as the formal input. And finally, it's about connection. Rural roles can feel quite isolated, so these events help people build relationships, swap ideas, and feel part of a wider rural network. That's what Staying Connected is all about, learning together and supporting each other to keep rural communities strong. I'm delighted to introduce our speakers this evening. We have Caitlin Evans, Rural Health and Wellbeing Manager at Cambridgeshire ACRE, who leads on the Fenland Community Cancer Project, who will provide a service overview. The main session today will be led by Kathy Davis and Nikki Harris, our two Macmillan Village Agents working on this project. This evening, they'll be sharing what the project is, what support's available, and how your parish or town council can get involved, and how communities can turn local ambition for how communities can support one another through cancer diagnosis. There'll be time for questions at the end, so please do add those to the chat as we go along. So without further ado, I'll hand over to Caitlin and the team.
Thanks, Hayley. That was brilliant. I'm only going to do a very quick 2 to 3 minutes overview, and I'm actually going to hand over to the lovely Kathy and Nikki for you this evening to do the actual awareness training. But hello, everybody. I'm Caitlin Evans. I'm the Rural Health and Wellbeing Manager for Cambridgeshire ACRE, and I'm excited to share with you a little bit about our service. As Hayley said, we're the Fenland Community Cancer Champion Service, and we're funded by Macmillan to deliver awareness for cancer signs and symptoms, to increase screening awareness and uptake, and as well as supporting clients affected by cancer, either individually or those who are maybe affected by having loved ones or friends and family that are going through a diagnosis. We have got 2 years that we have been delivering this service for. We've got one more funding left. And our team, they go out and about in the community across the whole of Fenland, as that's where we're specifically funded to support. They deliver home visits, running awareness sessions like this one, delivering events as well. They deliver outreach and drop-in sessions, so doing various different coffee mornings, activities to help increase people's awareness, but also to raise awareness of our service and to ensure that people are receiving support, as Fenland is in a particular area where there isn't any particular targeted cancer support ongoing at the moment. So we're the only service that's operating in that area. Our wonderful 2 staff members, Kathy and Nikki, are both here tonight. They'll be delivering the training for you all. They are fully trained by Macmillan to deliver the information and awareness sessions, as well as the practical and emotional support they offer to individuals across Fenland. I'll just give you a few little stats. So over the last 2 years, we've been able to deliver 156 individual multiple sessions for 156 individual clients. That's working on that one-to-one basis, and we work with individuals for as long as they need throughout their cancer diagnosis or beyond as well. And sometimes some people just need the initial first session for signposting or support. We've organised 16 different peer support group sessions. So we operate in 2 different areas across Fenland, support groups that are delivered by Kathy and Nikki themselves. And we've reached over 484 people, raising awareness of cancer across Fenland through different events and drop-in sessions as well. So without further ado, I'm going to pass on to Kathy, who will be starting the session, and then Nikki will be continuing alongside her. Kathy has been working with us since the beginning of the service, so for the last 2 years, and Nikki started with us last summer. And as Hayley said, if there's any questions, we'll be monitoring in the chat, so please do feel free to keep asking questions throughout as well. Lovely. I'll pass on to Kathy.
Thanks, Caitlin. Right, I'll just share some slides with you. Hopefully they'll come up in a minute. I've got them preparing at my end. Just taking a couple of seconds. Think it's a bit warm. Let me know if they appear at your end. They're not on mine at the moment.
No, they're not on mine yet, Kathy.
Hopefully they'll display in a little while.
They were working earlier on, weren't they?
They were working. They've worked all day until now. So hopefully it'll kick in a minute. I'll just give it a moment. If not, I'll try reloading it. It's always when you don't want it to not present.
I've got them loaded just in case you want me to have a go, Kathy.
All right, I'll try again. Let's have a look. Have they come up at your end now?
Yes, all there. Thanks,
Perfect. Perfect. Sorry about that, everybody. Thanks, Caitlin. So yeah, as Caitlin said, we're Macmillan Village Agents, who are specially trained by Macmillan to carry out support across Fenland. But a key part of our role is to raise awareness of the signs and symptoms of cancer, and that's really what today's short session is all about. So we want to try and raise your awareness of some of the most common types of cancer and look at how we can all play a part in helping others to become more aware of the signs and symptoms. So I want to kick off the session just by asking you all a very quick question, which you can answer by typing in the chat. On a scale of 1 to 5, how confident do you feel right now in talking about cancer? So there's no right or wrong answer. It's just about seeing where you're starting from. So if you're happy to type in the chat just whereabouts you think you are, that would be fantastic. Lovely. I can see some coming in now. Perfect. Okay, so there's a good mixture of where people are starting from. So our aim today is to give you more knowledge and confidence in talking about cancer. We want you to feel better equipped to share simple messages, help others understand why early detection matters, and encourage people to act when they notice symptoms. By the end of this session, we want you to be able to talk more comfortably about the signs and symptoms of cancer and the importance of screening programs, and support others who might have worries, and try to help people overcome some of the common fears and barriers that stop them from going to the doctors. So, what is cancer? Simply put, it's when cells in the body start growing out of control. And these cells can form lumps called tumours. And if they're left untreated, they can spread to other parts of the body. So some facts about cancer is that there's actually over 200 different types of cancer. And 1 in 2 people in the UK will develop cancer in their lifetime. But more people than ever are surviving cancer. But late presentation is a concern, as that can affect the chances of a good outcome. And by that, I mean people not seeking help when they may start to notice symptoms. It is estimated that thousands of lives in the UK could be saved every year if efforts to improve diagnosis and early presentation to the GP was increased. So before we dive into more detail about signs and symptoms, what do you think are the 4 most common cancers in the UK? If you've got any ideas and you want to, could you just pop them in the chat? You don't have to, but if you'd like to, please do. We've got some people typing. Okay. Okay, lovely. Quite a few of you have typed some in there. And yes, some of those are definitely correct. So the 4 most common cancers in the UK are breast cancer, lung cancer, prostate cancer, and bowel cancer. And each of these have symptoms that we can learn to spot. So in the next few slides, we're going to take you through them one by one and also talk about screening programs that can help detect these cancers early, potentially saving lives. So I'm going to start with breast cancer. Breast cancer is the most common cancer in women, but it can also affect men. The key is to be breast aware. Get to know your body and what's normal for you. If you notice any changes, that could be a lump, a change in size or shape, puckered or dimpled skin, or pain in your breast or armpit that's there most of the time. It's important to just get that checked out by your GP. Remember, you can develop breast cancer at any time, and that does include being younger than the age for which routine screenings start. And don't forget, it can also develop in between breast screening appointments. Changes in your breast may be harmless, but it is best to get them checked out. There's no perfect way to check your breast or chest, but the most important thing is to do it regularly and in a way that feels comfortable to you. So you could look in the mirror while standing up or laying down. Raise your arms, and looking from different angles can help you to notice if anything has changed. Breast cancer is the most common cancer in women, and the risk does increase with age. So routine breast screening is offered to anyone who is registered as female with their GP and aged between 50 and 71. Your first screening should be by the age of 53, and then it should take place every 3 years. Screening uses a low-dose X-ray called a mammogram, and this is to spot cancers that are too small to see or feel. And while screening doesn't prevent breast cancer, it does reduce the number of deaths from breast cancer each year, which is really good news. Screening can find cancer early before you know it's there, and the earlier breast cancer is found, the better your chance of surviving it. So it really is important to attend your breast screening appointments. Patients from Cambridgeshire and Peterborough with worrying breast cancer symptoms can now be referred directly to specialist clinics in hospitals without needing a GP appointment. The new self-referral service is available via NHS 111 online or the NHS app. And what this means is that patients do not need to wait for a GP appointment and subsequent hospital referral, offering eligible patients faster access to diagnostics care. Patients complete an online system assessment via NHS 111 online, and those that meet the eligibility criteria are then offered a direct self-referral to the specialist breast services at Addenbrooke's Peterborough City or Hinginbrook Hospital. Those who do not meet the criteria will then be provided with advice and signposted to alternative services that can help with their symptoms. Now on to lung cancer. It can affect anyone, even people who have never smoked. Symptoms include a cough that won't go away, coughing up blood, breathlessness, or losing weight without trying. And if you notice any of these signs, speak to your doctor. Lung cancer survival rates are generally lower compared to other types of cancer, but that's because over 2/3 of patients are diagnosed at a later stage. And although smoking is the main cause of lung cancer, people who have never smoked can still develop lung cancer, but their risk will be much lower. Lung cancer is responsible for more than 1 in 5 cancer deaths in the UK. If you have any of the symptoms on the slide, visit your GP. You may require a chest X-ray, and all of these symptoms could be caused by other conditions, not just cancer. But if you have any concerns, it really is best to get them checked with your GP because early diagnosis can make a real difference. Approximately 98,000 individuals aged between 55 and 74 in Cambridgeshire and Peterborough currently smoke or have a history of smoking. This number is expected to rise to more than 110,000 by 2029. The local rollout of the National Lung Screening Programme started in February in Huntingdon and Peterborough, with people at higher risk of lung cancer receiving a letter to invite them to book a free screening appointment. The programme is now being rolled out to other areas in Cambridgeshire, Peterborough and Royston, and by 2029 the programme will be available across the country, and that's really good news. Prostate cancer is the most common cancer in men. Symptoms include needing to pee more often, especially at night, or difficulty starting or stopping, or urgency of needing to pee. If something doesn't feel right, it really is worth having a chat with your GP, and they may do a simple test just to check. Anyone born with a prostate can develop prostate cancer. The prostate gland sits just below the bladder, surrounding the first part of the urethra, and it is about the size of a walnut, but that gets bigger as men get older. It's part of the male reproductive system, as the diagram shows on the slide, and the prostate adds fluid to semen, and its muscles push the semen through the urethra. Most prostate cancers usually start in the outer glands of the prostate, but it can develop in other areas. If the cancer is advanced, it can break through the covering of the prostate gland. Prostate cancer is very low risk in men under the age of 50, but risks will increase with age. And the older you get, the more you are at risk of developing prostate cancer. But there are also other risk groups to think about, and this can include ethnicity. Black men, for example, are more at risk. Those with a first-degree relative, so a father or a brother with prostate cancer, are at a higher risk, but also those who come from families with a history of breast cancer are at a higher risk of prostate cancer. More men are being diagnosed with prostate cancer, but the encouraging news is that deaths from prostate cancer are falling. The symptoms on this slide may be caused by problems that are much less serious than prostate cancer, so try not to worry if you develop any of these. However, you should get them checked out by your GP. There isn't a national programme screening for prostate cancer at the moment in the UK, But as a man gets older, his prostate may get bigger and it can restrict the flow of urine. That can be a common condition called benign prostatic hyperplasia. It is not cancer, but it can cause some of the same symptoms as prostate cancer. Your doctor will ask you about your symptoms and he may suggest a blood test. And that will tell the doctor about the levels of a protein called PSA, which is prostate-specific antigen, and that'll be in your bloodstream. High levels of PSA produced by the prostate can be an indicator of prostate cancer. However, the test can be positive for other reasons, and it does not provide a diagnosis of cancer. A raised PSA level may suggest that you have a problem with your prostate, but not necessarily cancer, and further tests may be needed. The doctor may also do a physical examination to see if the prostate is enlarged. So next up, I'm going to talk about bowel cancer. Looking out for the changes in your usual toilet habits. Bleeding from your bottom, tummy pain, or unexplained weight loss. Please don't be embarrassed to talk about these symptoms because they really could be important. Bowel cancer affects both men and women, and there are two main parts to the bowel, the small bowel and the large bowel. The food we eat ends up in the large bowel and it helps absorb water from your food and removes food waste from your body. The most common type of bowel cancer affects the large bowel, which includes the colon and the back passage. Large bowel cancer is also sometimes called colorectal cancer. More than 9 out of 10 people who develop bowel cancer in the UK are over the age of 50, but it can affect anyone at any age. Your risk of developing bowel cancer may be higher if you have a strong family history of bowel cancer, or you have a genetic condition or have a bowel condition such as colitis. But the good news is that more than half of all bowel cancers could be prevented through lifestyle changes, and we are going to be talking about some of these lifestyle changes shortly. If you notice any of the symptoms and they last longer than 3 weeks, please tell your doctor. These symptoms may be caused by conditions other than cancer, but if you have concerns, it is always best to check with your GP. Bowel screening helps catch cancer before you even have symptoms. It might not be the nicest thing to do, but it can save your life. The National Bowel Screening Programme offers screening every 2 years to all men and women aged between 50 and 74, with the option of requesting a kit over the age of 75. If you are aged between 50 and 74, the NHS will automatically send you the screening kit through the post, and this will have clear instructions on how to use it. It's designed to be completed in the privacy of your own home and at a time that is convenient to you. And it only takes a few minutes to do, and then it's returned in the prepaid envelope. If you are age 75 plus, you can still request a screening kit by calling a free phone number, which is 0800 707 6060. And as Hayley's going to hopefully share the recording of this, you'll have that number on there. 90% of people survive bowel cancer 5 years if it's caught early enough. So early detection really is key. So now I'm going to hand over to Nikki, and she's going to talk about some other factors to consider when we're talking about cancer. I shall just stop sharing my screen and hand over to Nikki.
Right, let's see if I can share mine. Sorry, you've got all my... Right. It's, there we go. Can everybody see that? Yeah.
Perfect.
Okay.
First time, Nikki. Thank you.
Okay. So other factors to consider when talking about cancer. So now we've had a great overview of the 4 most common cancers, I'd like to talk about some of the reasons why people put off going to the doctor, even when they begin to notice signs and symptoms. I put these on the slide. Time. Call your GP surgery if you need an appointment. In some GP surgeries, you may be able to have a consultation online or either over the phone. Fear. Lots of people avoid going to their GP. They make excuses and put it off because they may be scared, embarrassed, or they may feel the worst and not want to find out. Worry. Many symptoms that could be an indication of cancer can often be minor issues and may easily be dealt with. It's never a waste of time to get peace of mind from contacting your GP. Smoking guilt. 85% of lung cancer cases relate to smoking in some way. Because of this, many smokers think they will be stigmatized for their own illness and can often blame themselves. Minor symptoms. People put off visiting their GP with minor symptoms as they assume they'll clear up by themselves. In some cases, this will happen. However, if minor symptoms persist, then you should always contact your GP. Knowledge. Raising awareness of cancer symptoms, body awareness, and early presentation to your GP is vitally important to achieve early diagnosis of cancers. And then traditional attitudes. Delaying visiting your GP could mean that cancer is not diagnosed until a late stage, when the chance of a positive outcome is significantly reduced. Any changes that are persistent, unexplained, or unusual for you should be checked with your GP regardless of their severity. It's important that we challenge these attitudes by getting key messages across. The earlier cancer is diagnosed, the better. So what are your risks of getting cancer? Many people believe that getting cancer is purely down to fate or bad luck, but through scientific research, we know that our risk depends on a combination of our genes, our environment, and our lifestyle, some of which we can control. If we consider your biological sex at birth will predispose you to a certain level of risk to some cancers, e.g. those born female can develop gynecological cancers, and those born male are at risk of prostate and testicular cancer. If you think about your family history, some people are born with faulty genes that can increase their risk of developing cancer, and these can be passed from parent to child. If you have several close relatives with the same or related cancers at a young age, then this is more likely to be caused by an inherited gene change. However, only 12% of cancers are actually linked to genetics. The single biggest factor for cancer is age, which is not something any of us can do anything about. The risk of developing cancer increases significantly with age. Cancer starts when cells get damaged, and so the older we get, the more time there is for cell damage to build up, which can lead to cancer. Around 2/3 of cancer diagnoses in the UK occur in people 65 years and over. Around 4 in 10 UK cancer cases could be prevented. Research by Cancer Research tells us this. It's a big number. So what can you do to reduce your risk? Encouraging healthier habits is a massive part of cancer prevention. It's not about being perfect. It's about making small changes that add up over time. This slide shows some of the things we can do to reduce our risk. The first one is avoiding altogether or giving up smoking, the single best thing you can do for your health. The next is maintaining a healthy body weight, which is crucial for preventing various diseases and improving overall well-being. Eating a healthy, well-balanced diet, which is rich in vitamins and minerals, can play a big role in cancer prevention too. Getting into the habit of using sunscreen regularly and enjoying the sun safely by wearing a hat and seeking shade between 11 and 3 where possible. Well, today that doesn't seem to have been very possible. Minimizing alcohol consumption can significantly reduce the risk of developing several types of cancer. Minimizing alcohol consumption, sorry, I've already said that. Staying physically active and engaging in regular exercise. Protecting against certain infections, such as the HPV virus, by taking up opportunities for vaccinations when they're offered to us. Remember, diagnosing cancer as early stage significantly induces survival rates. So the main message I'd like you to take away from this session is that the earlier the cancer is found, the better the chances of survival. That's why conversations you have with others are so important. That conversation might lead to somebody taking action that could save their life. That's why we're asking people to spread the word across Fendon. That might be just having conversations with friends, families, or neighbours. It's about helping people feel more informed and less afraid. You don't need to be an expert, just willing to talk and share simple messages make a big difference. Keep talking, keep learning, and keep sharing what you know. We currently have 2 support groups running. One is at the King Edward Centre in Chatteris on the second Thursday of the month between 10:15 and 11:45 in the morning. And the other one is at March Library in the Wordsworth Room on the 4th of the month between 10:15 a.m. and 11:45 a.m. We have a coffee morning and art workshop taking place on the 2nd of June at St Wendrida's Church in March between 10 and 12 p.m. 10 a.m. and 12 p.m. Please follow us on social media platforms to see the updates on our support groups and other events that are coming up. To finish, I'd like to ask the same question that was asked earlier. How confident do you feel about talking about cancer now? Hopefully you feel a little bit more prepared and ready to support others. You want to put your in the chat, thank you. Well, I rushed through those a bit, but thank you very much for taking the time to join this session. If you have any questions, please feel free to ask now or pop them in the chat. Also, we have a 2-question feedback survey, which we'd like you to complete after today. Just please scan the QR code to answer this for us. And we've also popped a link to this in the chat. And also there's a link, there's a link in the chat to the feedback survey. Thank you very much. I think it's back over to Hayley. Okay, then for questions.
Yes, thank you very much. So we do have a question, which is family history appears to be a significant issue in the diagnosis, yet it is surprising how often older people do not know about their parents. Unfortunately, this also applies to many older people being embarrassed to tell their family. Is there any information such as posters we can use?
Absolutely, I'm happy to answer that one.
Yeah.
So we have a lot of Macmillan resources but that we can share with everybody on the call. We've got various different kind of leaflets, posters as part of that, but then equally we have our own service information and how you can get involved with obviously our Macmillan Village Agents for that kind of initial support and advice. So absolutely happy to share resources. Might be that I don't know what the best way to do that, but if you have any questions, I'm happy to put my email in the chat, and we're always happy to send information out to people. So I'll do that today, and if you take note of my email or obviously my telephone number if that's easier, then I'm happy to arrange for that as well.
Caitlin, have you got any that you can take with us tomorrow when we're at Little Thetford Village Hall?
Yeah,
because I believe that's the same Graham, so we could perhaps leave some or even put some up on his notice board for him.
Yeah, absolutely, right, no problem at all. You can do that.
We have got some people typing at the moment, so we'll just give it a quick couple of seconds.
Hi, Caitlin, can I just ask a question?
Of course you
can.
It's Sam. Any luck on the support group this way?
Absolutely. We have just finalised a date in Wisbech, which is fab. So, Nikki, you've just put together some posters as of the end of last week. So we'll be sharing those this week. So Sam, we can pass that on. So we're going to be doing a drop-in session in both Whittlesea and Wisbech, because they're the 2 areas of the sort of main market towns we haven't done a support group in yet.
Okay, so can you email me the details?
Absolutely. Yeah, absolutely.
Sam, it's actually in the community room on your suggestion, to be fair, at Tesco's. But I'll one of us will definitely email you the poster. Yeah,
if you email me all the information. Thank you. Okay. Sorry, I just wanted, I'm excited
fine.
about that.
Don't worry, No, you beat me to it. I've got a note to send it all out tomorrow. So
okay, thanks.
You're all good.
Thank you.
We have got another question come in the chat, which is speed of treatment is a concern. Do we know if this is getting any better or better in our area?
Did you want me to answer that?
Yeah, happy to. Yeah.
It's really tricky to get up-to-date data, to be fair, because a lot of the data that we can see is actually a couple of years old. So at the moment, we don't actually know. We do hope that speed of treatments and that are getting better, but unfortunately at the moment we don't have the full up-to-date figures because they're always a couple of years sort of behind. So but we will be keeping a close eye on it and checking to see if things are getting better and improving in the area. But yeah, sorry, that's the kind of answer to that one, that we don't know just yet.
There is a big I don't really know quite the word, but push on cancer support and prevention as part of the integrated health neighbourhood sort of transformation from the NHS. So cancer is a real kind of pillar that they're focusing on. So we're hoping to see some real positive change over the next, well, that 10-year plan, I suppose. But we're only getting drip fed little bits of information at the moment. So just to put it out there that obviously with the kind of evidence of cancer being like, 1 in 2 are going to be effective, is, luckily the NHS is taking this very seriously and putting things in place. And there's lots of talks from Macmillan wrapping, sort of trying to push initiatives and research and things like that as well. So yeah, fingers crossed we'll hear more. Sorry, it's a bit of a wishy-washy answer though.
And I just sort of want to say that the reason why we have Nikki and Kathy working in Finland is because the cancer rates in Finland were so bad that it was highlighted as an area that needed improvement, which is why we're doing everything today. So it's obviously on the radar that it needs to get better, which is good. Now we've just had another thing come in, which is I notice that I appear to be the only male on the call. I've had a number of conversations in my community hub with ladies about breast cancer, but is there a problem more generally about engaging men talking about cancer, either as the patient, carer or supporter? If so, what can be done about this?
So I don't know, Nikki, do you want to go or shall I go?
I just was going to mention that we've thought that was quite an issue as well. But at the support groups we're running, we found that sometimes there's more men now than women, and they're becoming very open about talking about their cancer. Particularly, there's one in Chatteris that we run, and we have 3 or 4 men there every single time. And we're joined by 2 new ladies who are talking in quite great detail about their cancers and the symptoms and what they've gone through. And the men were very, very, they were proactive in talking about their own cancers and listening to the women and talking about treatments, and there was no sort of embarrassment there. Sometimes men do find it more difficult to talk about personal things, which is well known, but we found that now people are aware of the support and the support groups, and that they're quite informal. They're not a scary place to go. You can just walk in. They're drop-in hubs as well. And we did find that the men, I don't know if you'd agree, Kathy, the men really were opening up a lot more than has been historic, so yeah.
Absolutely. And we have also had, the 2 of us, a lot of male clients that we're supporting one-to-one. So actually for our service, we've actually got quite a lot of men, and sometimes it's actually been more men than women that have been engaging in the support. So that's been quite interesting for us. We didn't expect that, but yes, that seems to be the case with our service, which is really good, because we did think that men might not want to come forward and be talking about it, but they actually are, which is great.
We've also got a lot of carers coming along, male carers, whose wives had cancer and either too poorly to come to the support group themselves at that particular time. So they come along and ask questions and as well. Yeah. So yeah, we are finding that there are a lot more men now than there used to be, which is good news. Yeah.
It's a sort of a follow-on question of what's brought that change about, do you think?
With the men coming along for support. I don't really know, to be honest with you. I think part of it is because they've been put in contact with our service through trusted people. So the community cancer nurses know a lot about our service and what we can offer. And quite a few of them have actually been referred to us from them. So I guess it's already a trusted person that's involved in their cancer care or their loved one's cancer care. So when they've said, how about if you want to talk to someone, you go along to our service and our support groups, whether it's because they've already come from a trusted person. I don't know, but a lot of them I think, Nikki, have come from social prescribers and community cancer nurses, haven't they? So
They have another
it
cancer
may well
wellbeing.
be, yeah, that we've got an avenue there with a trusted person already who's involved with their care or linked to a loved one's care or something. So yeah, that may be why they're more willing to engage.
We've also
Oh,
we
sorry, I
also
was
run an event
Yeah.
for men called All Right Mate in Wisbech. That was quite a big event and very well attended, and a lot of men came up to the stand that we held and asked lots and lots of questions about what support was offered, where they could go to get more information. So Caitlin, that was well attended, wasn't it? You know, so that was
Yeah, it was
a useful way of getting men involved as well. So via events that we do too.
Yeah, there was over 60 men that came along to that one for that specific event. But I think it's an interesting one because sorry, I'll just add this. And again, we sort of partner with the different GP practices quite closely for supporting with their events, and they've been doing a bit of a push for cancer awareness for men specifically. So there's been a couple of different men's events over the last sort of probably 8 months in the Fenland area and specifically. So I do think that those kind of specific targeted events do really help, just to allow men to have that space if they want to. So yeah, it's interesting to hear, Graham, your perspective though, what you're finding at your hub and how that sort of, you know, maybe there's something we could do there, you know, to partner with yourself potentially or offer advice and information again to sort of support men, you know, receiving more information and having that confidence to kind of discuss any issues they might be experiencing or just any experiences they've had with cancer in the past or present.
Okay, I think there's a couple of other comments in the chat, but they're not questions. Samantha says, when we attended the event at the rugby club in Wisbech, it was a really good event. So yeah, really nice to have that sort of feedback. I think that's sort of drawing it to a close. So I'm going to go back to sharing my screen. I was going to go back to the beginning, isn't it? Yes, it is. Let's. So I just wanted to spend a couple of minutes just reminding you of the support that's available. So yeah, I need to start by thanking everyone for coming along and participating, and particularly thanks to Caitlin, Kathy and Nikki for sharing their knowledge and wisdom with us all. But just sort of a quick reminder now that Cambridgeshire ACRE is a membership organisation and the reasons why you consider joining if you haven't already. So membership gives practical support when you need it, whether that's telephone or email advice from our team, regular funding updates, or discounts on more in-depth consultancy and training. You become part of our online members network and receive our monthly Staying in Touch newsletter, so you can keep up with what's happening across rural Cambridgeshire and pick up ideas you might want to try in your own community. Members get invited to training, workshops and events just like this one, where you can learn, share and build those really valuable rural connections. We're also keen to shine a light on the amazing work happening locally, so we can promote member projects through spotlights and case studies wherever we can. And of course, as a member, you have a voice in the organisation, including the chance to vote at our AGM and help shape our future direction. But more than any single benefit, membership is about being part of the wider movement that's making a real, tangible difference. Together, we're helping create stronger, greener and better connected rural communities across Cambridgeshire. We'd love you to be part of that. So just wanted to briefly share with you the next two Staying Connected sessions. The next one is on the 30th of June, which is When Things Go Wrong, How Communities Step Up. And that's being led by the Cambridgeshire Community Resilience Forum. The Cambridgeshire Community Resilience Officer. So yes, he's relatively new in post, but just sort of talking about what you can do to be prepared, which is really interesting. And then just a week later, on the Wednesday, the 8th of July, it's Rural Housing Week. So we're having an event led by our rural housing enablers, talking about rural affordable housing in your parish. If you'd like more information on those, please go to our website. So thank you all very much for coming. Thank you very much to Caitlin, Kathy and Nikki. Please, can you complete the cancer screening feedback questionnaire, which is in the chat? I'll also pop that in an email. Tomorrow, hopefully, if I can make everything work, we will be sending you the recording and the slides. So thank you very much, everyone. Go and attempt to cool off. Go and find yourself an ice cream or something.